Hi guys, welcome back to Danielle Klee SLP. My name's Danielle, and today we'll be talking about one of my favorite topics, which is orofacial myofunctional disorder, orofacial myofunctional therapy, and temporomandibular joint dysfunction, otherwise known as TMD. So if you have any questions about what an orofacial myofunctional disorder is, you can feel free to look back at some of my other videos. That'll be helpful when we're having this discussion. But to give you some background on temporomandibular joint dysfunction, it refers to dysfunction of the TMJ joint. Oftentimes, TMJ and TMD have been used interchangeably. I prefer TMD because TMJ is just the temporomandibular joint, so it isn't referencing a real issue. TMD is inflammation and a variety of different problems and concerns with this joint. It's often associated with pain chewing, eating, feeding, drinking, sometimes even speaking, opening the mouth, reduced range of motion, dislocation of the condyles of the mandible in the joint. And unfortunately, it's also associated with a lot of pain, oftentimes referred pain. So patients with TMD can have ear pain, they can obviously have jaw pain, neck pain, head pain, shoulder pain, and TMD can significantly impact a patient's quality of life and even ability to participate in activities of daily living. I'm so passionate about this topic because I suffered from TMD for many years, and myofunctional therapy was a huge part of my remediation. And it's exciting because we're going to talk about some research today that shows a correlation between a myofunctional disorder and TMD, and then the ways that therapy can help patients manage some of their TMD symptoms. So a lot of the research on these topics comes out of Brazil, and specifically the University of São Paulo. If you go onto PubMed, you'll see lots of studies from Brazil. We're so thankful for the meaningful research they're doing out there. And one study in particular I want to draw attention to today is a study that was completed by Ferreira in 2009. Ferreira et al., and they looked at the correlations between incidence of orofacial myofunctional disorder and the incidence of TMD. And they found that there was a strong correlation between patients who had TMD and who also had OMD. For all sakes and purposes, I'm not going to get into too many abbreviations on this talk. I know a lot of abbreviations. So TMD and myofunctional disorder. And they found that these disorders were often comorbid, meaning that they existed together. And if you think about it logically, that makes a lot of sense. So patients who have TMD are often clenching the jaw, grinding the teeth, have pain to the muscles of the face. It's not surprising that they might have a myofunctional disorder where they're recruiting some of the wrong muscles when they're eating, they're feeding, and they're swallowing, and so forth. Now, the exciting study was completed by Felicio et al. In 2010, and they found that orofacial myofunctional therapy can be really helpful in remediating or helping manage pain and symptoms associated with TMD. So the study was done at the University of São Paulo, and Felicio and her team found that myofunctional therapy was effective in reducing TMD intensity. So the intensity of TMD symptoms were reduced with myofunctional therapy. Myofunctional therapy also provided a reduction in the frequency of patients' TMD symptoms. Myofunctional therapy provided a reduction in TMD facial pain. So a lot of patients with TMD have myofascial pain, and overall noticed a decrease in those symptoms. And then finally, myofunctional therapy helped include TMD patients' jaw range of motion. So a lot of great insights here in this study. And the great news is that myofunctional therapy is non-invasive, for patients who've potentially had multiple jaw surgeries or are looking at other much more invasive measures. Myofunctional therapy, as we talk about, is just the neuromuscular repatterning of the muscles of the mouth and the face and the tongue. And it's helping get the tongue in the proper place when you're hopefully nasal breathing and going about your day, watching TV on the computer, and also making sure that you're swallowing correctly with the right muscular recruitment and tongue placement, because we swallow 500 to 1,000 times a day. So myofunctional therapy can be a great set of tools and strategies for patients with TMD to help remediate some of their symptoms and pain. I know that it definitely was for me. Of course, it's important though that a patient is thoroughly evaluated by a professional, but it's especially effective for patients who also have an existing myofunctional disorder. So if you guys have any questions or any comments, please feel free to leave them below. Again, you can learn more at daniellekleeslp.com, and you can also visit my Instagram, daniellekleeslp, for weekly tips, strategies, and insights related to the latest research. Thanks so much and have a great day.